would like to introduce the procedure of KBCT guided biopsy. And a biopsy bracket can be attached underneath the table. The breast is stabilized in the bracket by a grid and a backplate, so that the breast won't move during the biopsy procedure. And usually we do 4 scans. With 4 scans in the whole procedure, following the procedure, the scanning procedure. Usually they do in MR guided biopsy. It's just much faster. The first scan is a pre-biopsy scan. It helps locate the lesion. Once we find the lesion, in this case, there's a lesion that's ready to be biopsied. The breast is already stabilized by the grid. As you can see, this is a grid, and there's a back plate in the back. And we locate the lesion by going through the slices. And of course, before the biopsy, and the doctor probably already know where the lesion is. And we have a tool here. Go to the biopsy toolbox, and we have the tool to set the whole image to a biopsy mode. We can use the tool to align the grid perfectly in the image, and then we can use this tool to quickly measure the depth. Once we click, the depth from the grid to the lesion is marked in the image. Yeah, if we zoom in, so this depth is about 26 millimeter from the grid to the center of the lesion. And we have, based on what device you're using, there are different vendors for the biopsy devices, and we can have these masks for the needle block that you're going to use. For example, we select the needle block in here, and once the needle block is selected, the entry point of the needle is marked with a big red dot in the 3D image. So this matches the exact location of the lesion. We can drag this mask on top of this grid hole. And if the dot is not perfectly matching in the needle block, we can rotate it so that there got to be a hole, the needle hole that matches the entry point to guide the needle to set up the cannula. Once everything's done, the doctor has all the information necessary to create the biopsy, to insert the biopsy cannula. So we have the grid location, and we have the depth. So follow the biopsy device instruction, they can insert the biopsy cannula. After the cannula has been positioned, we can have the second scan to confirm that the cannula has already reached the position of the lesion. So this is a second scan, the confirmation scan. After the confirmation, doctor can follow the biopsy device instruction to sample the tissue. After the tissue sampling, we have a third scan called post-biopsy scan. As you can see that after tissue is sampled, there leaves some spaces in the breast, so that you can get confirmed the tissue is successfully extracted from the breast. And then they can place a biopsy marker, and we have a fourth scan to confirm the marker has been placed in the correct location. Basically, these 4 scans, typically the whole procedure can be completed approximately from 15 minutes to 20 minutes. Usually radiologists, if they have experience in MR guided biopsy, they may find this procedure very familiar. It's just much faster. Okay, so to conclude the introduction of the Koning breast CT viewer, some clinical cases, and Koning CT viewer is a dedicated viewer for the best experience of Koning breast CT review, and all these necessary tools can help the radiologist to find the lesion, measure the lesion and provide their diagnosis decision. And also we have the biopsy toolbox can provide the best experience for KBCT guided biopsy.